I would like you all to take a moment to think about the disabilities that many individuals are affected in their everyday lives. Think about what is cerebral palsy. Think about people you may personally know with cerebral palsy or any other disability. How are they different from other individuals without any disorders? And lastly, how did they end with a condition that affects their everyday functions, and what are the treatments given? Over the years, the interest in disorders grew when William Little, an English surgeon, created the first medical identification of spastic diplegia and was the first to record in writing the condition. Not only did Little raise awareness of the cerebral palsy condition, but it was just the beginning of all the discoveries made over the years. Cerebral palsy became a frequent disorder in many children around the world, which led to the examination of the similarities among children with this disorder called cerebral palsy. According to an article published on their website, last updated in 2017, evaluation of feeding disorders, including gastroesophageal reflux, Asagharshidze et al., came to the conclusion that cerebral palsy is a diagnostic term used to describe a group of permanent disorders of movement and function that causing activity limitation and are attributes to a non-progressive disturbances, fetal or infant brain. Among many research done with children with cerebral palsy, many educated individuals seem to have come to the same agreement that their brain had a difference than other children without a condition. Discoveries are made every year, but most experts come to the same insight as Little did back in 1960. In the book Clinical Pediatric Neurology, in chapter 21, Disorders of Motor Execution 1, Cerebral Palsy, Barry S. Russman determined that by finding an abnormal MRI scan of the brain, a history of motor defect that is not worsening, and examination indicating that an abnormality of the brain is responsible for the motor defect, the presence of spasticity or dystonia, or all of the above diagnosis individuals with this disorder. Here's an image of a child with dystonia. As you can see, he has severe cerebral palsy, but not all children are the same like him. It is more common in boys more than girls, as stated in the article entitled Evaluation of Feeding Disorder, including gastroesophageal reflux and oropharyngeal dysfunction in children of cerebral palsy. 3.6 out of a million were male, and female ratio of 1.4 out of 1. Adding to the recent studies done on cerebral palsy have found that there are different types of this disorder that affect children. The research does not end there. There are different types of cerebral palsy, including hemiplegic brain damage or spinal cord injury that leads to paralysis on one side of the body. Diplegic refers to paralysis affecting symmetrical parts of the body, and quadriplegic affecting or relating to paralysis for all four limbs. Tetraplegic. Although there's many research done, researchers continue to add to the conclusion, even sometimes improving the understandings of the condition cerebral palsy. The purpose of such improvements are to raise better awareness and to have a better understanding of the condition cerebral palsy. Cerebral palsy is mostly common to form of chronic motor disability that begins in childhood. So now that we know how a person is affected by cerebral palsy and the different types of effects palsy carries, let's go into more detail about the struggles they face in their lives. So this is a back brace that most cerebral palsy children need to wear in order to have great posture. According to many educated individuals, like Little, for example, have all made a tremendous impact on the foundation of cerebral palsy. Different risk factors start from as early as labor and delivery periods, including vaginal bleeding in the same time of admission and placental complications such as abruptio and breech presentation. Different kinds of defects differ from each patient, some having less severe disorders and others having more of a severe condition. According to an article entitled Evaluation of Feeding Disorders, including gastroesophageal reflex, last updated in 2017, Assagarzi et al. Discovered patients with cerebral palsy suffer from permanent defects in movement and functional capacity and disturbances of sensation, perception, cognition, communication, and behavior, as well as by epilepsy and secondary musculoskeletal problems. Not all cerebral palsy patients experience the same defects. This is part of the reason why all beliefs regarding cerebral palsy are true to an extent, because they all came down to the same conclusion that it affects the brain by damaging it in the end. So now that you know the different impairments along with struggles that occur in many diagnosed cerebral palsy conditions, let's go into more detail about the types of treatment options provided specifically for them. What treatment is there for individuals with cerebral palsy? This is Levi. Yeah, he may not look like he has severe cerebral palsy, but he indeed does have his defects. Treatment for cerebral palsy includes all types of therapy, depending on the needs of the child, and in some cases, surgery, along with the medication for some, according to the magazine Highlights, entitled What I Wish You Knew About Me. There M. Hallwell et al. Interviewed 10-year-old Levi Hallwell. He said, I've done physical therapy, speech therapy, occupational therapy, and hippotherapy. Working with a therapist while riding a horse. Not only do some children need extra therapy sessions because of their disability, cerebral palsy, but it seems that most of the time these children are considered as different and have a hard time adapting to their environment. In conclusion, I have informed you about what cerebral palsy is, what causes it, and what treatments are provided for individuals with cerebral palsy. Even if you do not know of someone with a disability like cerebral palsy, many individuals, along with yourself, have a better understanding and knowledge of what cerebral palsy is and how it affects many individuals, and lastly, the different treatments they are given for their special needs. Thank you.